Do you or someone you know suffer from heart failure? If so, you'll be excited to learn about sacubitril, a groundbreaking medication that could change the lives of millions. In this video, we'll explore the incredible potential of sacubitril and its ability to revolutionize the treatment of heart failure. Heart failure affects millions of people worldwide, causing debilitating symptoms and a decrease in quality of life. But with sacubitril, there's hope for a better future. This medication works by inhibiting an enzyme that is responsible for the negative effects of heart failure, allowing the heart to function more effectively. Clinical trials have shown promising results, with patients experiencing reduced hospitalizations and improved overall survival rates. With the potential to improve symptoms, increase life expectancy, and enhance overall well-being, sacubitril is a game-changer in the world of heart failure treatment. In this video, we'll delve into the science behind sacubitril, explore its benefits and potential side effects, and provide valuable information to help you understand if this medication is right for you. Don't miss out on this revolutionary heart failure treatment. Read on to unlock the potential of sacubitril. Understanding the mechanism of action of sacubitril. Sacubitril works by inhibiting an enzyme called neprilysin. Neprilysin is responsible for breaking down certain proteins in the body, including a substance called natriuretic peptides. These peptides play a crucial role in regulating blood pressure and fluid balance in the body. In patients with heart failure, the levels of natriuretic peptides are often elevated, indicating an imbalance in the body's regulatory mechanisms. By inhibiting neprilysin, sacubitril allows the levels of natriuretic peptides to increase, which in turn leads to vasodilation, widening of blood vessels, and diuresis, increased urine production. These effects help to reduce the workload on the heart, improve blood flow, and alleviate the symptoms of heart failure. It is important to note that sacubitril is usually prescribed in combination with another medication called valsartan. Valsartan is an angiotensin receptor blocker, ARB, that helps to further reduce blood pressure and improve heart function. The combination of sacubitril and valsartan is known as sacubitril-valsartan, or LCZ696. The mechanism of action of sacubitril is unique and sets it apart from other heart failure medications. Its ability to target the underlying mechanisms of heart failure makes it a promising option for patients who have not responded well to traditional treatments. Clinical trials and evidence supporting the effectiveness of sacubitril. Numerous clinical trials have been conducted to evaluate the effectiveness of sacubitril in the treatment of heart failure. One such trial, known as PARADIGM-HF, compared sacubitril-valsartan with enalapril, a commonly used medication for heart failure. The results of the PARADIGM-HF trial were groundbreaking. Patients who received sacubitril-valsartan experienced a 20% reduction in the risk of cardiovascular death or hospitalization for heart failure compared to those who received enalapril. Additionally, the risk of all-cause mortality was reduced by 16% in the sacubitril-valsartan group. These findings were so significant that the trial was stopped early, as it was deemed unethical to continue giving patients the less effective treatment. The results of the PARADIGM-HF trial were published in the New England Journal of Medicine, solidifying the efficacy of sacubitril-valsartan as a first-line treatment option for heart failure. Other clinical trials, such as Transition, have also demonstrated the benefits of sacubitril-valsartan in specific patient populations, such as those transitioning from intravenous heart failure medications to oral therapy. These trials provide further evidence of the effectiveness of sacubitril-valsartan in improving patient outcomes. The wealth of clinical data supporting the use of sacubitril-valsartan makes it a compelling treatment option for patients with heart failure. Its ability to reduce hospitalizations and improve survival rates is a testament to its potential to revolutionize the treatment of this debilitating disease. Comparing sacubitril with other heart failure medications. When it comes to treating heart failure, there are several medications available, each with its own unique mechanism of action and benefits. Let's compare sacubitril-valsartan with some of the commonly used medications for heart failure. ACE inhibitors. ACE inhibitors, such as enalapril and lisinopril, are a class of drugs that work by blocking an enzyme called angiotensin-converting enzyme, ACE. This inhibition leads to vasodilation and a decrease in blood pressure. While ACE inhibitors have been the standard of care for many years, sacubitril-valsartan has shown superior efficacy in clinical trials. Beta blockers. Beta blockers, such as metoprolol and carvedilol, work by blocking the effects of adrenaline on the heart. This leads to a decrease in heart rate and blood pressure, reducing the workload on the heart. Beta blockers are often used in combination with other heart failure medications, including sacubitril-valsartan, to provide comprehensive treatment. Diuretics. Diuretics such as furosemide and spironolactone help to remove excess fluid from the body, relieving symptoms of fluid overload in heart failure patients. While diuretics are effective in managing fluid retention, they do not address the underlying mechanisms of heart failure like sacubitril-valsartan does. Digoxin. Digoxin is a medication that helps to strengthen the contraction of the heart muscle, improving its efficiency. It is often used in patients with heart failure who have a reduced ejection fraction. While digoxin can be beneficial in certain cases, it does not have the same comprehensive effects on heart failure as sacubitril-valsartan. It is important to note that the choice of medication for heart failure depends on various factors, including the individual patient's condition, underlying causes of heart failure, and any other medical conditions they may have. Consulting with a healthcare professional is essential to determine the most appropriate treatment plan. Benefits and advantages of sacubitril for patients with heart failure. Sacubitril-valsartan offers several benefits and advantages for patients with heart failure. Here are some key advantages of this revolutionary medication. Reduced hospitalizations. Clinical trials have consistently demonstrated a significant reduction in hospitalizations for heart failure in patients receiving sacubitril-valsartan compared to traditional treatments. This reduction in hospitalizations not only improves quality of life, but also reduces the burden on healthcare systems. Improved survival rates. Sacubitril-valsartan has been shown to improve overall survival rates in patients with heart failure. The Paradigm-HF trial in particular demonstrated a 16% reduction in all-cause mortality in patients receiving sacubitril-valsartan compared to enalapril. Symptom relief. Many heart failure patients experience symptoms such as shortness of breath, fatigue, and fluid retention. Sacubitril-valsartan helps to alleviate these symptoms by improving heart function, reducing fluid overload, and increasing exercise tolerance. This leads to an overall improvement in the patient's quality of life. Fewer side effects. While all medications have the potential for side effects, sacubitril-valsartan has been shown to have a favorable side effect profile compared to other heart failure medications. Common side effects include low blood pressure, dizziness, and an increased risk of hyperkalemia, high potassium levels. However, these side effects are generally well tolerated and can be managed with proper monitoring. Combination therapy. Sacubitril-valsartan is often used in combination with other heart failure medications, such as beta blockers and diuretics. The synergistic effects of these medications can provide comprehensive treatment and further improve patient outcomes. The numerous benefits and advantages of sacubitril-valsartan make it an attractive option for patients with heart failure. Its ability to address the underlying mechanisms of heart failure, reduce hospitalizations, and improve survival rates sets it apart from other medications in the field. Potential side effects and precautions when using sacubitril. Like any medication, sacubitril-valsartan has the potential for side effects. It is important to be aware of these potential side effects and take necessary precautions when using this medication. Here are some common side effects and precautions associated with sacubitril-valsartan. Low blood pressure. Sacubitril-valsartan can cause a drop in blood pressure, especially when starting or increasing the dose. This can lead to dizziness, lightheadedness, and an increased risk of falls. It is important to monitor blood pressure regularly and adjust the dosage as necessary. Hyperkalemia. Sacubitril-valsartan can increase potassium levels in the blood. This can be problematic for patients with kidney problems or those taking other medications that increase potassium levels. Regular monitoring of potassium levels is essential to prevent complications. Kidney function. Sacubitril-valsartan can affect kidney function, particularly in patients with pre-existing kidney disease. Monitoring renal function and adjusting the dosage accordingly is important to prevent further kidney damage. Pregnancy and breastfeeding. Sacubitril-valsartan is not recommended for use during pregnancy or while breastfeeding due to potential risks to the fetus or infant. It is important to discuss alternative treatment options with a healthcare professional if you're planning to conceive or are currently pregnant or breastfeeding. Drug interactions. Sacubitril-valsartan can interact with other medications, including non-steroidal anti-inflammatory drugs, NSAIDs, potassium-sparing diuretics, and certain antihypertensive medications. It is important to inform your healthcare provider of all medications you are taking to prevent potential interactions. It is crucial to consult with a healthcare professional before starting sacubitril-valsartan to ensure that it is safe and appropriate for your specific condition. They can provide guidance on potential side effects, monitor your progress, and make any necessary adjustments to your treatment plan. Dosage and administration guidelines for sacubitril. Sacubitril-valsartan is available in tablet form and is typically taken orally. The dosage and administration guidelines may vary depending on the individual patient's condition and response to treatment. Here are some general guidelines for the use of sacubitril-valsartan. Starting dose. The recommended starting dose of sacubitril-valsartan is usually 4951 mg, sacubitril-valsartan twice daily. This dose may be increased to 97-103 mg twice daily after 2-4 weeks if tolerated. Titration. It is important to titrate the dose of sacubitril-valsartan slowly to minimize the risk of hypotension, low blood pressure. This can be achieved by starting with a lower dose and gradually increasing it over several weeks. Combination therapy. Sacubitril-valsartan is often used in combination with other heart failure medications, such as beta blockers and diuretics. The dosage and administration of these medications should be coordinated with the healthcare provider to ensure optimal treatment outcomes. Missed dose. If a dose of sacubitril-valsartan is missed, it should be taken as soon as remembered, unless it is close to the next scheduled dose. In that case, the missed dose should be skipped and the regular dosing schedule resumed. Compliance. It is important to take sacubitril-valsartan as prescribed by the healthcare provider. Skipping doses or stopping the medication abruptly can lead to worsening heart failure symptoms and potential complications. Always follow the specific instructions provided by your healthcare provider regarding the dosage and administration of sacubitril-valsartan. They can tailor the treatment plan to your individual needs and monitor your progress to ensure optimal outcomes. Thanks for watching.